And good afternoon, everyone, from St. Louis, Missouri, and the home of the Missouri Institute of Mental Health. I'm Tom Pansella with MIMH, and I'd like to thank you for joining us this afternoon as we begin the UMSL Jubilee Web Conference Series. We're actually doing double duty today because, as you'll learn, our two presenters are also going to be at our Spring Training Institute, which you've heard me plug a number of times if you've been with us on these programs. But if you haven't, your first time joining us, welcome. Take a look around the video screen. You'll see a few things there. Right under the video window, you'll see the caption box. We welcome our captioner, and we're glad to provide this service to you, an open text captioning, just in case you want to follow along that way. Below that, you'll see several links, including a link to the slides as a PDF file, also a link if you're interested in purchasing CEUs, which are still only $10 per person, and also below that, you'll see our links to our Spring Training Institute. Off to the right, you'll also see the link to you'll also see the open chat box. That's if you have any questions at all during the program today. Any questions or comments, use that chat box next on the right side of the screen. We'll ask those questions on your behalf after the presentation block today. And so I'd like to introduce Matt Clethermes. I knew I'd screw that up today. Matt Clethermes and Kate Drury, and they're both from the University of Missouri St. Louis, and both with the Children's Advocacy Services of Greater St. Louis. Kate provides comprehensive assessment psychotherapy services to traumatized children and adolescents and their non-offending caregivers. She's received extensive postgraduate training in child traumatic stress and implements multiple empirically supported treatment models, including trauma-focused CBT, parent-child interaction therapy, and child-parent psychotherapy. At the Children's Advocacy Services, she also provides clinical supervision to social workers and social work students, and she provides training and consultation in evidence-based trauma treatment models throughout Missouri. And Dr. Clethermes, how come I can't say that today? I don't know. Matt, he's a licensed psychologist and a health service provider at the Advocacy Center, and he's an associate clinical professor in the Department of Psychology at UMSL. He has over 12 years' experience working with traumatized youth and has received extensive training in this area, including exposure to multiple trauma-focused evidence-based practices. Currently, he provides direct clinical services to children exposed to trauma and their non-offending caregivers. He supervises the clinical work of mental health trainees, and he provides frequent training and consultation at the local, state, and national levels. His primary professional interests include complex trauma, assessment and diagnosis of traumatized youth, effective trauma-focused engagement strategies, and child traumatic grief. And Matt and Kate, the floor is yours. Welcome.
Thank you.
Well, thanks, everyone. Really glad to have you here. So we are really spending this presentation focusing on the initial part of what is child traumatic grief. So we certainly hope that those of you who are able to come to the Spring Institute will attend when we present there as well, because we're going to be focusing a lot more on the issue of treatment at that point in time. So I think without further ado, we can go to the first slide.
Great.
Okay, so we want to start off just by talking about why is the issue of child traumatic grief important. And there's a few reasons for that. The first is that child exposure to death is actually pretty common. Research suggests that about 5% of children and adolescents in the United States experience a crucial loss of a loved one by age 15. So, that's actually a fairly high number. If you think about a classroom of about 20 kids, you can anticipate that at least one of those kids will probably have had this sort of experience. And then if you look at different populations, this number goes up even more. There's another research study that was done with inner city youth who found that by age 21, over half of those children had experienced the sudden death of a loved one by the time they turned 21. And that when they looked at the different types of trauma that these youth experienced, traumatic death was the most common one that was reported. We also know that people often overlook children's exposure to death. It's something that frequently people assume children are not impacted by it, or they're just not aware of how they're being impacted by it. Another thing that we know is when you incorporate trauma into death, death can be a really horrifying and traumatic experience for a child. It's something that they rarely understand. They see a lot of things that they're not familiar with. They see a lot of adults who are very upset and distressed. And we also know that a fair number of kids who have experienced the sudden death of a caregiver tend to have really significant and prolonged grief that can last up to 3 years. So we know that this is something that does have a pretty significant impact, and that's why we're wanting to address it today.
Okay.
That's me. Okay. So there's a lot of challenges for doing work with children and the issue of children and grief. And one of the major ones is that just in general, society has a very hard time talking about death. We all know that there's a variety of different euphemisms that people use. Things like the person's gone, they've left us, they've expired, they're sleeping, they've passed on, I lost this person. Then you get into the more maybe less formal ones, things like pushing up daisies, bit the dust, kicked the bucket, bought the farm. So all these really just unusual terminology that's out there that can be really confusing for kids who take things very, very literally. And it really seems like the more taboo a subject is, the more euphemisms we have for it. I think death and sex run neck and neck in terms of the number of euphemisms that we have for them. And so this is really a challenge because when caregivers are using this sort of communication, it really just muddies the water for the kids.
Mm-hmm. So another one of the big challenges that kids have in looking at death and grief is just their understanding of death as a concept. So starting around, age 2 to about age 4, kids are really egocentric. It's all about them. And they have a difficult time with the concept of death. They see death as reversible. They see it as abandonment and not permanent. So you might hear a young child say, my mommy died, but when's she going to be home? So these kids just obviously have a really hard time understanding that death is final. Then between the ages of 4 and 7, they still see death as reversible, and then they also start having a lot of feelings of responsibility about death. So they might think my mommy died because we had a big fight, or if the child was angry at their parent and then their parent was in a car accident, they might really see that themselves as being personally responsible for that. Then around age 7 to 11, kids are starting to see death as final and permanent, but they still wish it was reversible. So that can kind of be a difficult transition for them. Then these kids they can focus on bodily harm and mutilation and have a lot of fear around those things. And kids also tend to see death as punishment around that age. Then around the age of 11 to 18, these kids are developing a more adult-like understanding of death. So because they have more abstract thinking by now, they understand that death is permanent. They're working at making sense of what's going on. This is where religious teachings might come into play, and they're trying to use spirituality and things like that to help make sense of death. So those are just some of the challenges that we're facing when we're looking at this population. There's a broad range of levels of understanding for how they see death and how they understand that concept. Okay. And then this next slide just kind of goes through how a person develops an understanding of death. So the hamster's not moving, but he'll play with me tomorrow. So that's a very, very young child who still thinks that death is reversible, not permanent. And then they start saying, they understand that the hamster won't ever play with me again. Maybe they've heard their parents say that. They're starting to really understand what that looks like. And then they say, okay, then they can understand about people. Old people die and we never play with them again. And then they start thinking about people they know. Well, grandpa might die one day in the future. And then as they grow a little older, they can understand that actually it could happen to someone even closer than grandpa. It could happen to mommy or daddy. They might die one day when they're old. And then kids start to come to the realization that they themselves will die. So I'll die someday when I'm old. And then looking at mommy and daddy some more, they'll say mommy or daddy could die tomorrow if something happened. And then finally, the most advanced understanding would be I could die tomorrow. So that's just kind of how death, understanding of death and kind of progresses. Okay. Mm-hmm. That's your turn. Mm-hmm.
Okay. So when we're looking at uncomplicated grief, so if we eliminate trauma from the equation and we're just talking about grief by itself, we definitely see a lot of pretty, I hate to say typical because there really is no typical response to grief. Mm-hmm. Everybody, every child, every adult grieves a little differently. But some things that we do tend to see really kind of fall into a few areas. There will be some sort of emotional distress. So whether that's sadness, irritability, confusion, a sense of loss, there is this emotional impact. There will also be some sort of a cognitive impact, so the way they think. So it could be something like just being overly preoccupied with the death, not being able to think about anything else. Or it could be just different ways of thinking about what happened. It could be a sense of blaming themselves for what happened. It could be feeling guilty because they didn't have a better relationship with the person before they died.
Or feeling guilty because they're still alive and the other person's not.
Yeah. We could also see some physical impacts of the grieving process. So kids may suddenly start to show things like increased stomach aches, headaches, sleep difficulties. So just a lot of physical issues may come into play. You may also see different changes in how they're functioning on a day-to-day basis. They may be struggling with doing their chores now. They may not be able to get their homework done. They may not be eating the way they used to. And then finally, this is, I think, really common with young children in particular, but you can see some developmental impact of grief. So you may see regressive behaviors where a child starts to have accidents that had previously been potty trained. You may see an adolescent who's maybe trying to accelerate their development and doing really risky adult-like behaviors. So you can see a lot of impact there as well. I think some things that are interesting about kids is that kids don't tend to grieve in a sustained fashion. A lot of times it's referred to as short grief spans, so sort of like a short attention span, where they tend to grieve and then sort of move away from grieving for a while and can often look as though they're not grieving at all. And frequently that can be misconstrued by the adults around them, either making them think that the child doesn't care as much about the person that died or that they're getting better. And that really may not be the case. And then I think another thing that's an issue with grief is that even though we would expect that a lot of these things with typical grief would gradually decline over time, it is important to remember that grief lingers, and there really is no necessarily a defined end to grief. It will change, it will decrease in intensity, it will decrease in frequency, but there will still be periods of that emotional loss as well. And I think just one last point to distinguish uncomplicated grief from what we're going to be talking about in a bit, traumatic grief, is the idea that even though they've got these sorts of symptoms like the sadness, the sleep problems, they're still able to have positive memories about the person who died. They're able to access those, talk about those, share those with people. And generally speaking, they're able to do all of the sort of necessary life activities that they need to do. They may be challenged by it, but they're still able to do them.
So continuing to talk a little bit more about typical grief or the grief process, we've moved away from a stage-based understanding of how people grieve, and now the field is looking at more tasks that people complete in the process of bereavement. And they complete them not in a specific order, but more at their own rate and in different ways. So we know that the first task of grieving is to experience that pain that's associated with a death. And that can be very, very hard for people looking at young children to let them do that. And so we tend to say to children, I'm so proud of you for being so strong in the, when their parents died, and we really reward them for not showing a lot of signs of emotion. And that can be hard for kids because it sends them the message that it's not okay to experience those feelings of pain and suffering when someone dies. But we really need to do that in order to grieve and to move on. Another one of those tasks of bereavement that people accomplish is accepting the permanence of death. And again, this is one that can be particularly challenging for children just due to their cognitive limitations. And so we want to really help them with that by explicitly saying that, mommy or daddy won't come back, they won't be able to play with you anymore, they won't be able to eat with you or make dinner for you. And for some adults, that just feels really mean. It feels like kind of rubbing it in, or why would I want to help them understand that their parent's never coming back? But it is actually really important because kids need to understand death before they can begin to accept it, before they can move on. So that's definitely a job of the caregivers involved, is to help that understanding of death evolve. Another task of bereavement is to reminisce about the deceased and to have those memories like Matt just talked about, to be able to look at pictures and talk about things that the child and the person who's died have done together and things like that. That's actually a really good sign if they're able to do that. And then converting the relationship with the deceased person from one that's in the physical, in the present, to one that's in the past. And so we like to think about relationships with deceased people as relationships. It's just not one that that's reciprocal or that's happening in the here and now. Instead, it's one of thinking about the person, remembering things about the person, thinking about what that person might be saying to you if they were here, that kind of a thing. Then we want to help kids, and even adults do this when they've lost someone, incorporate aspects of those loved ones into their self-identity. So that could be physical traits like eye color, I have the same color of eyes as my mom, or it could be things, other traits like activities that the child, I'm a good baseball player, my dad was a good baseball player, so they can kind of take on some of those traits and weave them into their self-concept, which will help them take a part of that person with them. And then we want people to recommit to new relationships, and that's true for adults. We don't want them to mourn their partner for the rest of their life, although I might tell my husband differently. And it's true for kids too. We want kids to recommit to new attachment figures. We know that kids need supportive relationships in their life. We want them to attach to new caregivers. They might have to, if they're in a foster home, we want them to attach to the new foster parent. If their parent brings a new partner into the home, we want them to have a good relationship with that person. So we can try to encourage those relationships to develop.
I think something that's really challenging around that issue is when we're talking about a family, different family members are going to be at different levels of preparedness for that. So you may have a sibling who's really interested in getting to know new people, filling that role of the person who was deceased, but then you have another child or maybe a parent who's just not ready for that yet.
I think that's a great point, because people accomplish these tasks at their own rate. So some people might not have accomplished yet being able to reminisce about the deceased person without it being overwhelming. So they're not able to talk about it. But if their family member has accomplished that with no problem, then they might be bringing up the person all the time and having a lot of pictures around the house. And so that can create a little bit of a conflict for people living in the same home who haven't accomplished the same tasks yet. And then the last task of grieving is reestablishing the developmental trajectory of the child. So, if the child has had some regression that would be expected after a trauma or a loss, so if they started wetting again or sucking their thumb or being afraid to separate from their parent, we want to see that not happen anymore. We want them to be where they need to be developmentally. So if it's an adolescent, we want them to be individuating, separating from their parent, developing their own identity and interests, that kind of thing.
And finally, I think one last important aspect of this particular topic as we're going forward into the issue of traumatic grief is they call these tasks for a reason, and that's because they take effort. These are not things that just happen sort of spontaneously on their own. The person, the family, the child, whoever it is, needs to put actual effort into making these things happen. So they're not always an easy thing to commit to, and they require work and effort, and there's going to be discomfort as well.
And that's why grief counseling can be so helpful, because part of the job of grief counseling is to help people accomplish those tasks.
Okay, and so this brings us really to the topic for today is the concept of child traumatic grief. And really what we're dealing with here is death that occurs in a situation that, death of a significant person that the child perceives it as being traumatic. And so it's really critical to keep in mind that there's no sort of perfect definition of what trauma is, and that trauma is often sort of in the eye of the beholder. And this can be really true of death when it comes to children, because we may have, let's say, a grandparent who has been dealing with a long illness. They've been in the hospital for a long period of time, everyone in the family is sort of expecting that the death is going to occur, but then even the child may know that it's coming. But then you may have a situation where that child goes to visit the parent or the grandparent and is either witness to a lot of other sick people in the hospital, sees all the machinery that's life support machinery, things like that, that's in place, may witness the person being in significant amounts of pain. And all of those things can make what from the outside looks like a relatively normal death be perceived as traumatic by a specific child. So we really want to keep in mind that it's the perception of the child that's really important. And then ultimately what we see is when we have this sort of traumatic reaction to a death, what happens is we have an interaction of that traumatic reaction and grief. And it's not a positive interaction. It typically causes a lot of disruption in the grieving process. And really what it comes down to is it's that the ability to go through those tasks of bereavement is interrupted. It's impinged upon by the trauma symptoms. And the main way that this works is kind of through the idea of reminiscing. So basically, for all extents and purposes, the process of grieving becomes a trauma trigger. So thinking about that loved one, whether it's a positive memory or not, tends to lead to trauma reactions. So it can trigger re-experiencing symptoms, avoidance, numbing, hyperarousal. And of particular concern with traumatic grief is the issue of avoidance. Because what we tend to see happen is since reminiscing triggers these sorts of negative reactions, they tend to want to avoid it. So they tend to try to stay away from thinking about the person who died. They don't want to think about committing to new relationships. They certainly don't want to experience the pain of the loss. They don't want to think about what parts of the person are they incorporating to themselves, because it creates all of this fearful trauma reaction. And ultimately, anytime, just the way our brain is structured, fear always takes priority over sadness. So if they're dealing with that fear, that's what they're going to be focused on, and grief is going to take an absolute back seat. And so just some of those typical experiences of grieving, like guilt, anxiety, anger, all tend to be kind of magnified and exacerbated when trauma comes into play.
Okay, well, we're going to talk a bit about the factors that can influence the severity of the traumatic grief response, but I really want to emphasize that this is a very subjective process. So what might be very traumatic for me might not be traumatic at all for Matt, and vice versa, and that's certainly true when we're talking about traumatic grief in children. But looking at some external factors, we know that the manner of death can be a factor. So the more violent typically the death, the more unexpected the death, then the more traumatic generally. So when there's been a long period of preparation and people have had time to talk with the child about what death means, that this person's sick, that kind of thing, then the child is just more prepared. They might go into the experience with a more solid understanding of death, and that makes it a little bit easier. Whether or not the child witnessed the death is a very important factor, because witnessing the death brings the possibility that they'll have a lot of those re-experiencing symptoms. Instead of being able to think about their dad the way they knew him, they might just think about their dad covered in blood on the sidewalk, and that whenever the word dad comes up, that's just what they go to immediately. So that can be a big deal if they witness a death, if it's a car accident or a shooting or anything where they're actually seeing it happen. Then the quality of the child's caregiving and social support after the death can play a big role into how severe the traumatic grief reaction is. We obviously want children to have really closely attuned caregivers who are responsive to what they're going through, encouraging them to express their feelings, helping them talk about the person who died in a way that is not overwhelming to them, that kind of a thing. And I think that can actually bring a lot of hope for parents and loved ones of children who are grieving, because there is that sense of we can do something about it. By supporting the child, being there for the child, being really attuned to the child, that could really mediate the child's response. And then secondary adversities is another really important factor. So if a child loses their primary caregiver, for example, not only might they have to go through the grief process in the morning, but they might also have to move in with someone else, someone they might not know as well, change schools, and all of those things can make the adjustment process that much more difficult. Instead of having their old network of friends at their old school, they have to make all new friends. And sometimes I think we give short shrift to those secondary adversities because we're so focused on the grief and the death that the child experienced. But those secondary adversities play a big role too. And then looking at internal factors, so qualities of the child that can influence how severe their traumatic response is, might include their developmental stage. So the younger children, I think people oftentimes think, oh, they're too young, they don't know what's going on, they won't remember this, and that's just not true. We really think that for children under 5, just the death of their primary caregiver is traumatic in and of itself, even if it was an expected death, even if the death occurred in the best possible context. We know that losing that attachment figure just has great implications for the child's ability to regulate, to develop a stable sense of identity, a sense of self, and so that can just be very, very traumatic. And going along with their developmental stage is their cognitive stage, and cognitively, how are they able to understand death? As we talked about before, understanding death is a really important part of being able to accept and move on. And so if the child is at a developmental stage where that's just not possible, we're going to have to work a little harder with that child to get them through the process. And then the child's own emotional resources. If they're a good coper when other bad things happen, then they'll be a good coper when things like grief and loss happen to them. So their level of pre-existing coping skills plays a big role. The child's temperament too. I mean, we know that kids with easy temperaments are going to do a little better when someone dies and they experience a loss, just like they'll do a little better if they have to change schools or their parents get divorced. That's just one of the things about temperament, is that it's very influential in people's responses. And then finally, the child's history of prior traumatic events can play a role. So if a child has had a number of traumatic events before this happens, then their emotional resources are already spread pretty thin, and they won't have as many left over to process the grief. They also just might not have the caregiver support that they need, and they already might be experiencing some post-traumatic stress symptoms. So that just sets them up for a little bit harder time.
Okay. Something that is a pretty critical concept with regard to child traumatic grief is the idea of the role that reminders play. And really, when we're talking about reminders, this can be just about anything. Any thought, any reminder, even happy ones about the person who died can lead to those sort of traumatic memories or images that Kate mentioned earlier, like just thinking about Dad brings back the image of Dad laying there with blood on him. So it brings those things and makes it feel like the trauma is right back there in the room again. And really with traumatic grief, I think it's even more challenging sometimes than it is for general trauma like physical abuse or domestic violence, because there's a lot of different kinds of reminders that can come into play. So you can certainly have trauma reminders, which are just any sorts of places, situations, people, sights, sounds, smells, anything like that remind the child of the actual death. So examples could be like the particular street corner where a friend of theirs was shot and killed, or it could be a bedroom where their grandparent died, or it could even be a sound of an airplane if they had a parent who died in a crash or something along those lines. So it's anything that reminds them of that specific traumatic death. But then you can also have things that are a little bit more associated with grief. And the problem is that because there's this trauma involved, they don't remain grief reminders, they also become trauma triggers. So things like loss reminders, which are just anything that reminds the child that about the person who died. So it could be things like photo albums that have pictures of the person. It could be an empty chair at the dining room table.
Grandparent day at school.
Grandparent day or school. Just anything that reminds them that there's this big hole where this person used to fill a role or a need. Now that, for most of us, we would experience that as a sense of loss, sadness, grief. But unfortunately what happens for these kids is they experience that, but then it quickly gets translated into, oh my gosh, now I'm thinking about the way this person died. And so it triggers that traumatic reaction. A very similar type of trigger is change reminders. And really what we're talking about here is anything that reminds the child that their life has changed as a result of the death. And Kate mentioned earlier the idea of secondary adversities, and frequently those things are change reminders. And so they are pretty important because they then frequently become trauma triggers as well. So it's things like so many kids have to move to a new house, go to a new school district. Eventually they may have to do things like cope with a new paramour for mom or dad or something like that. So it just reminds them that there's been this change, which quickly segues into now I'm feeling panicked, anxious, afraid.
In looking at how we can identify those children who have child traumatic grief as opposed to just typical grief that we would expect, I think it's really important to understand that this is just a small percentage of children who experience a death. Most kids go on and do fine, and they are sad and have some symptoms, maybe some aggressive symptoms, some sadness and crying, and then it slowly resolves over time with support. And these kids are able to talk about the person who died, they're able to enjoy activities and function pretty well. So that's most kids. But some kids, a subset of those kids, go on to develop traumatic grief. And we can identify them primarily based on the trauma symptoms that are impeding their ability to function and impeding their ability to accomplish those tasks of grieving. So we're going to be looking for those classic PTSD symptoms of re-experiencing. So this can happen through dreams or flashbacks. They're re-experiencing the death in some way. They could have sudden thoughts or images of the death come into their mind, and that's really interfering with their functioning. Avoidance is another hallmark PTSD symptom, and we'll see this in child traumatic grief when kids aren't able to tolerate talking about or hearing about the person who died. And they might start to engage in other behaviors to avoid thinking or talking about what happened. So they might suddenly start acting out at school where they hadn't before, or not listening at home, because those behaviors will get them a certain amount of attention that will then serve to distract them from the very upsetting thoughts and images. We also see arousal, and that might be hypervigilance, where they're constantly on guard for danger. They might be worried constantly about another person dying, so wanting to check on their other parent or a sibling all the time to make sure they're okay, constantly worried that that person's going to die in a car accident or get sick, something like that. Then child traumatic grief also has in common with regular grief and bereavement other symptoms like depression and anxiety, behavior problems like we talked about, attachment difficulties where they're not attaching well to their caregiver, they're not having that really attuned relationship, they're not going to their caregiver if they're distressed, or seeing that caregiver as a secure base.
And it's possible that for some kids they're not doing that because it again triggers that sense that they no longer have this other parent, and then they're starting to feel those trauma
symptoms
as well.
Then these kids also might have social problems at school. It could be that perhaps their hypervigilance is creating some social difficulties where they're not able to interact as well with the other kids socially, or they're just so sad all the time that other kids aren't wanting to hang out with them and have them over to their house. These kids also might be feeling angry at God, angry at the person who died, angry at themselves for what they perceive might be a reason that the person died. They might be having a lot of guilt about that. It's misplaced guilt, but they might have a lot of feelings of self-blame. And then yearning, we see this a lot in very young children and infants. We know that they express grief by often searching for that person, not understanding that the person won't come back, and just continuing to look places for that loved one who's gone. And then some kids experience some rescue and revenge fantasies, and these are the kids who will talk about going back and saving their parent, or finding the cure for cancer in time for their parent to survive. These are kids who just can't accept that death is final and their parent's not coming back.
I also have a really good example of that concept that also really illustrates the importance of honest communication about death with children. I worked with a colleague one time who had a client who was a roughly 6-year-old boy, and his mother committed suicide. And he was then in the care of his grandmother, who really, was struggling clearly herself with her daughter's suicide, and really couldn't come to terms with that, and instead told the son that, basically that some bad person had broken into the house and killed his mom. And so then subsequently he developed a whole lot of revenge fantasies around trying to track down this mysterious person who did this, which created all kinds of complications, because he would talk to his grandma about that, and then it just really was a challenge to try to tease that apart.
Actually, suicide creates a number of problems for families in terms of how to explain the death and how to understand that and make sense of that. And so one of the things that we do is tell kids that that person made a really bad mistake, that they didn't want to leave the child, but that they were in so much pain that they made a mistake. We want to emphasize that so that the child doesn't see suicide as an option to solving their problems.
Okay. Now, just as sort of a brief teaser for what we're going to be talking about at the Spring Institute, we wanted to touch a little bit on traumatic grief treatment. And basically, I really sort of viewed CTG treatment as, in many respects, being kind of similar to having a clogged sink and cleaning that up. And the reason I say that is because within CTG, those trauma symptoms kind of act like that clog in a sink, and they prevent all of that grief from sort of draining out or processing. So that means really for treatment, we have to address those trauma symptoms first. Whatever sort of typical trauma-focused treatment, whether it's something like trauma-focused cognitive behavioral therapy or a couple others that Kate's going to be talking about here in a second, we really need to address those symptoms first. And one primary reason being that we need to reduce the avoidance so then they can go forward and start to do some of that grief work. Now, I will say that sometimes when you're dealing with child traumatic grief, that initial trauma-focused treatment does need to be adapted. So you're going to be providing education about child traumatic grief, about death, about dying. So there's going to be a lot of work helping them understand those concepts. There may be parenting work that has to be done to address the fact that you may have a caregiver now who is a single parent all of a sudden and is coping with that. Relaxation may be an issue. Frequently for some kids, they may associate a lot of relaxing activities with the person who has passed away or died. And so what used to be relaxing may no longer be relaxing and may actually be a trigger for some kids. So there just may be some changes that we need to make to that initial trauma work. Once we feel like that avoidance and those trauma symptoms have decreased significantly, then we can start to integrate grief-focused components, which are largely based on those tasks of bereavement that we mentioned earlier. They're really designed to help children progress through those tasks. And then finally, one last thing that I do want to say about child traumatic grief treatment is there really is no specific time limit. Just like there's no time limit for how long you need to grieve, the treatment may actually require, for some kids, a relatively compressed amount of treatment, but for others it may be fairly extended. So we don't want to try to set a schedule on grief work.
So looking at the range of evidence-based treatments that are available for child grief, probably one of the most utilized and studied models is what Matt just talked about, the trauma-focused cognitive behavioral therapy for child traumatic grief. So, and Matt's just talked about that. There's a lot of literature available on that model, and we'll be talking about it at the Spring Institute in a couple months. There's another one called the trauma grief component therapy for adolescents, and that is a model that was originally developed for survivors of war and other very severe traumas for about middle adolescence through adolescence, so ages around 11 through 18. And it's a phase-based approach that uses assessment, psychoeducation, and psychotherapy to help kids overcome their trauma symptoms and accomplish those tasks of bereavement. Those are the two evidence-based treatments that are available for grief, but we know there are lots of other evidence-based treatments for trauma that could be used to address the trauma symptoms, and then moving on to more traditional grief counseling to help the child resolve those tasks of bereavement. So child-parent psychotherapy is a model for very young children, infants through age 5 or 6, that involves the caregiver in every session, and it involves them sharing the child's story over and over again using play and books to work on the relationship and the attachment between the caregiver in therapy and the child. Then integrative treatment of complex trauma is a longer-term trauma treatment model that uses a variety of different theoretical orientations and different skills and things like that, where they do focus on telling the trauma story, gradual exposure, working on attachments with caregivers, and then finally working on those grief tasks of bereavement. Then we have attachment, self-regulation, and competency. Matt, do you want to say a little bit about that?
It's not something I'm horribly familiar with, but I do know it's similar to most trauma-focused treatments. It is more of a phase-based model that has specific categories of skill building and components that they progress through, and does involve a lot of trauma processing as well.
And then Real Life Heroes is another attachment-based trauma model that really works on building on kids' strengths and inner resiliency and attaching to their caregiver while overcoming their trauma at the same time. So those more general trauma models can be used with these kids to address those trauma symptoms before they would be able to go on and really go through the grief process.
And just as a last slide, we have our contact information up here. If anybody wants to get in contact with us, you'll notice Kate's email address. You don't have to worry about mine.
Either one of us
Just
is fine.
Kate's is fine.
We do encourage people to ask questions using the chat window alongside the video window. We did get a couple of questions
Great.
that have come in. This goes back to your discussion of the grief tasks.
Okay.
And knowing, of course, that you deal mostly with children, but are these grief tasks specific to children and adolescents, or are they present in the adult grief process as well?
That's a really great question, and we know that these tasks are true for everyone who experiences a loss. The one that's a little different would be reestablishing the developmental trajectory would be different, because in children it would probably just be more relevant and much more important, whereas although with adults too, we do think they can go back on the trajectory of finding a partner and moving forward with their developmental stage as well.
And I think that these tasks are largely the same, I think, for across age ranges, but I think how they look can be a lot different.
Absolutely.
The specific behaviors that are going to be involved may look a lot different, clearly, for a 2-year-old versus a 13-year-old versus a 40-year-old.
And how people make meaning out of death is going to change.
Another question. You see that kids' involvement with violent video games impacts one way or another their real-life experiences of grief.
I'm going to let Matt answer that one.
Figures.
He plays more video games than I do.
I don't know. I honestly don't know what the literature is around that. I do think there is concern about video games in terms of desensitization to violence. So I do think there could be some possibilities that it could potentially cause desensitization to death as well. But honestly, I really do not know the literature around that.
That's an interesting question.
It is a very good question.
Person works with homicide victims' families and sees often where parents and family caregivers have been reluctant to share what happened or who was involved in the murder, especially in the 8 to 12 age group, how can she work with the parents to allow them to tell the children together with the family what actually happened?
Well,
We do work with a lot of not homicide victims, but their children in our center too, and it can be really, really challenging. And with trauma and with grief, there can be a lot of secrecy and shame wrapped up in that. And one of our jobs as therapists is to really help the family understand that that is not helpful for the child in moving through the grief process or in overcoming their trauma symptoms. That we need to be able to talk about the story and exactly what happened for healing to really happen.
And another thing that I think is important too, when we're talking about telling a kid what really happened with regards to death, we're talking about doing it in a developmentally appropriate way. So, the amount of information that they need to understand at the level that they are. And definitely there's no need to get into things like gory details,
Oh, absolutely.
anything like that. But just being very straightforward about the cause of death and then try to answer questions about that as honestly as possible.
There is a really great book called After a Murder that's available through the Dougie Center, and it can be used with kids probably second grade and up, and it's a workbook-based book, but it has a really good way of explaining a homicide is when another person kills another person on purpose, that kind of a thing. And the Dougie Center also has a book called After a Suicide that could be really helpful for families experiencing that one.
All right, you're on a roll here. My daughter lost her dad at 15 months old. Now she's 5 and talks a lot about him and heaven, etc. Will she experience her grief in different stages of her life in different ways?
Yes, I would absolutely. First of all, I'm sorry to hear about your daughter's loss. And I think it's a positive sign that she's able to talk about him. And I think that that's showing that you're providing a lot of support for her that she needs, so that's great. I think she will have the loss come up again and experience grief at different stages. We would expect that at different transitions in her life, such as maybe graduating from high school or graduating from college or getting married or having a baby, that those kinds of things bring up the grief, and that's true of adults, and that's definitely true for kids. So, and maybe not, with her it might not be the memories of him, but the absence of him will be noticeable for her at those times. But with your support and with the coping skills that she'll develop over the years, I would expect that would be, a bit of sadness, but she would be fine and able to move on just fine.
I think some really critical issues is just to normalize that's expected, that there's going to be these periods in time, so she knows that that's going to be an issue. I think preparing for what are going to be difficult times, whether it's dad's birthday or whether it is things like graduating from high school, getting married, just having that be an ongoing conversation where you're continuing to prepare.
That's a great point, and actually in treatment we often use worksheets that will say, what do you think might be a time when you'll have some grief, you'll re-experience grief or really miss your parent, and so we'll write down, when I get married, and then we'll talk with, how can you cope with that? Well, I could have a picture of him at the ceremony, or I could have my uncle walk me down the aisle, that kind of a thing.
And I will say, just to distinguish, between, so I think this is an approach once we're actually at the grieving process. When you're still dealing with the trauma side of it, that's most likely not going to be effective because they're not going to be prepared to do that. They're going to be very avoidant of those sorts of discussions. And so it's going to be really critical to address that trauma side first.
Right.
Going back to the homicide-related question, she's having specific issues with families who may have the other parent as the suspected perpetrator. To what extent should parents share the information, at least before the trial begins? What is appropriate to share at what stage?
That's a really hard question.
You already threw me under the bus. So now it's your turn.
I would say it depends. It depends on what the child already knows and what their developmental stage is. But I think the big concern is that the kids are going to know anyway. They're going to hear from other relatives. They're going to hear from kids at school or in the news. And so it's better to come from a parent first so that the parent can really set the stage for how the kid thinks about what happened and thinks about what's going on.
And a very common occurrence that I've seen is the kids already know much more about what happened than the parents think they do. Because they hear things.
So I always suggest starting out that conversation by saying to the child, tell me what you know about blank, and letting the child tell you all the things that they've heard, and then you can help fill in the blanks and correct things. But you want to do that earlier rather than later because they are going to find out about it.
And I think one of the real challenges when when a caregiver waits is then the kid starts to have this sort of negative, okay, why did you not tell me this? Or may even think that the parent or whoever was lying to them about something, and then it creates a real negative vibe around those sorts of discussions.
And having worked with children who've had one parent murder the other parent, I can tell you that the kids oftentimes have ambivalent feelings about the parent who committed the murder. And they might be very, very angry with that person, but they also might have feelings of love for that person. They might really defend that person. So I think you just have to walk that line between, and allow them to share both sides of those emotions.
Is the grieving process the same for losses other than death, such as divorce?
Matt and I were just talking about that yesterday.
I think the short answer is it's similar but different. I mean, there's aspects of death that make it a very different grieving process, and largely just because of the absoluteness and permanence of it. Whereas, like with a divorce, there is still an ongoing relationship, typically with whoever the estranged spouse may be. So there's some differences, but you will see some similarities in terms of, initially not wanting to accept it, maybe not wanting to engage in a relationship with stepdad or stepmom because they're super loyal to the other parent. So I certainly think there's going to be some similarities, but differences as well.
I would agree. And I would say moving into foster care can be very, very traumatic for children. So that's one example where I think there can be trauma symptoms develop, but it's not quite the same as a death.
All right. I think you ran the track there.
All right. Well, thank you so much.
Everyone.
Thanks, folks. Thanks for joining us this afternoon. As we mentioned before, Kate and Matt are going to be presenters at our Spring Training Institute, which we help coordinate on behalf of the Missouri Department of Mental Health. There's a website set up for that. There's a lot of tracks and topics that are going to be at that program. There's going to be more than 60 sessions at that program, and they're going to be amongst our stellar array of presenters at that program. So I encourage you to take a look at the website, which is www.mimhtraining.com/STI. You can link to it right off of mimhtraining.com. We will forward that link along with the link for the purchase of the CEUs and the links to the slides, and follow-up email, which we'll send you in the next day or so, along with a link to the archive video. So with that, we'll say we hope you join us for all the rest of the UMSL Jubilee web conference series of this series, as well as all of our other web conferences, which are available on our website. We thank you for joining us. Matt, Kate, thanks for your time today.
Thank you.